Mpumulo means rest in Chichewa, the official language of Malawi. This is the site on which the Mpumulo Women's Center will be built. The center will provide the women of Malawi a sense of hope, a respite from the poverty and stress they must deal with each day. Malawi is a small country in southeastern Africa with a population of nearly 16 million people. More than half of them live on less than $1 a day. According to the United Nations 2010 Human Development Report, Malawi is ranked as the 17th poorest nation in the world. This economic hardship means that the people of Malawi must struggle each day just to survive. But poverty is always worse for women. Gender-based violence and a lack of adequate health care further complicate daily life for women and their children. Physical violence and rape are not uncommon, and this contributes to the high rates of HIV/AIDS among the female population. While access to life-saving antiretroviral drugs has helped to decrease the death rates, many women are still living with HIV, which contributes to other health problems such as TB and pneumonia. Access to health care is a major problem. Public health clinics are overcrowded and, in some cases, long distances from the communities that need them most. High rates of maternal mortality and infant mortality persist.
Nurses in Malawi, they're hardworking. They really want to work, help the patients. But the problem and the challenges we are having in our hospitals are just a lot. Okay. As I'm telling you, we don't have drugs. And most of the hospitals, they don't have enough equipment so that a nurse, you can work as you have been trained to work as a nurse.
Education, a well-known contributor to good health, is another challenge facing Malawian women. Literacy rates for women are lower than for men, especially for women over age 15. According to UNICEF, 80% of men are literate as compared to only 66% of women. Under the direction of Dr. Rachel Rodriguez from the Edgewood College School of Nursing and Dr. Ellen Chirwa of the Kasungu College School of Nursing, the center will be built on 8 acres of land currently owned in the community of Machinjeri, about 15 minutes outside of Blantyre.
I hope that one day we'll have a center well constructed and we'll bring our women there, empower them, and help them to have a better place in the society. And in the process, we are going to address issues of gender-based violence, help them to make decisions in their marriages, and also maybe if we can have resources, we can have a clinic there where we can bring the mothers and the babies, and they can just receive the basic care. That's my vision.
The center hopes to house a small clinic, 2 classrooms, and a space for training women in sewing, knitting, and other skills that can help them start small businesses to generate income and improve their standard of living. When the center is fully operational, it will focus on 3 main goals. It will provide basic health care for women and children, offer training to develop income-generating skills, and provide basic education. Basic health care will include education about HIV/AIDS, TB, pneumonia, and malaria. It will also provide counseling about gender-based violence. The center will provide women with opportunities to learn income-generating skills, with a focus on agriculture and the creation of textiles to sell in local markets. For many, this opportunity will be their first step towards self-sufficiency. Women are empowered through the program by learning to read and write. This story, posted on our Malawi Women's Health Facebook page, is a testimony to the success we are seeing after a few weeks of initiating the literacy program in Blantyre.
After only 6 weeks, this literacy program, a part of the evolving Mpumulu Women's Center project in Malawi, has already produced remarkable results. 4 of the initial 13 women enrolled in this class now have basic reading skills. Impressive when you consider that a great majority of adult Malawian women can neither read nor write. Basic math skills are also an important part of developing income-generating skills and helping women become self-sufficient. Simple addition is taught using a homemade abacus made from wire and bottle caps. Nothing fancy, but it works.
But as is the case with all good work, funding is critical. The Mpumulo Women's Center will become a reality if there is financial support. Your contribution will help women in desperate need in a part of the world many of us don't even know exists. The Mpumulo Women's Center must be a reality. Women's lives will change. Your contribution will lead to their success.